New at 11, in 2014, more than 28,000 people died because of prescription opioid pain medication and heroin.
The Centers for Disease Control also reports since 1999, sales of opioid pills nearly quadrupled in the United States. You've heard politicians blame the doctors writing those prescriptions. But in this story, you'll hear doctors say government rules bear some responsibility for the addiction problem. You hear the same story over and over. Pills, then heroin, seduce and enslave.
I would do anything for it. I put myself out there in ways I never thought I would.
How so?
I danced for it. I stole from my family, stole from people, I stole from stores.
The scars on Mallory Martin's arms silently testify to her addiction. They also remind her how life was.
Miserable, lonely, and painful.
Before she found help at Maryhaven.
So what about treatment?
Where she's breaking heroin's hold over her.
I wake up today free.
Mallory started using socially as a teenager, but one woman in her group session who asked us not to show her face got hooked as a patient. But how did it start?
Well, I was like 25 years old. I got my wisdom teeth pulled. I was prescribed Percocet. I loved them.
So much, she spent $400 to $500 a day on pills and doctor shopped to get more until heroin became the cheaper, easier high. She says that one prescription she didn't ask for started the slide. Cases like hers have generated a lot of conversation in the medical world. Do you worry when you prescribe that you could be creating an addict?
Absolutely.
Dr. Alan Gora is the chairman of the emergency department at Mount Carmel Health System. He and other physicians we spoke with say America's prescription pill problem isn't as simple as doctors overprescribing. It's an issue that has history.
Back in the 1990s, there was a big push that said physicians aren't managing and treating pain appropriately. It's been a mandate for the government for the last 2 decades for us to better manage patients' pain.
Opioids offered an effective way to do that, even though, unlike other metrics, pain is tough to assess. So when you measure vital signs like your blood pressure or the oxygen level in your blood or your heart rate and your temperature, you get definitive numbers. See? You see it on the screen. But with pain, what they call the fifth vital sign, it's entirely subjective. The patient rates it. Just listen.
Are you hurting anywhere?
Yes.
On a scale of 0 to 10, 0 being no pain, 10 being the worst, what would you say your pain is right now? A 9. And where would you put that 9 out of 10 pain at on your body?
It's in my throat.
The patient also might rate how the doctor or hospital managed her pain in a government-mandated quality survey like this one. It, among other things, asks, how often was your pain well controlled? And it doesn't stop there. Government reimbursement to hospitals, meaning money that keeps them in business, is tied to overall survey scores. And consider this.
We're now seeing patients who come in with an unrealistic expectation of, look, I know what I have and I know what I need. This is what I've always gotten. This is what I need. I need something stronger for pain.
That very patient has potential power in the survey, and medical providers know it. Here's a presentation from Iowa that we found called How Pain Management Influences Patient Satisfaction. And it asks the million-dollar question, how do we improve patient satisfaction pain scores? It does not advise to just prescribe, but it shows there's been concern in the industry about surveys and scores, concern Dr. Gora has felt. Have you yourself ever worried about how somebody's going to rate you?
Absolutely.
Yeah?
Absolutely.
He says he hasn't caved into the pressure and does not know a doctor who has, but
I think it's unrealistic to think that some of these surveys don't impact prescribing and test ordering patterns of physicians.
in a recent letter to the Department of Health and Human Services, the American College of Emergency Physicians said it worried the survey system would ultimately penalize hospitals and doctors who choose to limit opioid pain relief and reward more frequent prescribing. It asked to examine, quote, whether there is a connection between survey measurements and inappropriate prescribing patterns. It also asked to remove pain-related questions from quality surveys that determine reimbursement until that examination is complete.
On one end, we're trying to help the epidemic. We're throwing more money at it. We're actually creating guidelines for physicians on how to prescribe opioids appropriately. We're educating patients. But on the other hand, we have these surveys that are completely acting in the face of that.
Now, I'm told that letter from the American College of Emergency Physicians never got a response. But you know what? We did. The Department of Health and Human Services says although data does not suggest a tie between overprescribing and pain questions on surveys, it's reviewing the matter and field testing alternate pain questions. If nothing happens there, a congressman is pushing what's called the PROP Act, which would not allow a patient's subjective take on pain management to influence reimbursement to hospitals. Central Ohio's Steve Stivers is a co-sponsor.